Recognize him for 5 minutes for opening statement.
Chairman Pitts, Ranking Member Pallone, and members of the subcommittee, thank you for having me here today to testify about H.R. 2453, the Medicare Beneficiary Preservation of Choice Act. I am very pleased to discuss this bipartisan legislation that Congressman Kurt Schrader and I introduced in June of 2013. Enacting H.R. 2453 is one small fix we can make to Medicare Advantage that can have a big impact on the lives of the seniors utilizing the program in our districts. It simply restores the open enrollment period that existed prior to 2011. This open enrollment period permitted seniors to change Medicare Advantage plans once between January and March if needed. It essentially lets seniors test drive the Medicare Advantage plan they would have just selected and change plans if it turns out that the plan is not working for them. H.R. 2453 is about choice and fairness for seniors. It is about empowering them to make decisions about their health care needs. Restoring the January to March open enrollment period also makes sense in light of the 2014 Medicare Advantage cuts and the new cuts just proposed by CMS. Last November, the Wall Street Journal reported that one of the nation's largest Medicare Advantage providers had dropped thousands of doctors from network due to significant changes and pressures in the healthcare environment. This is significant because seniors may not have known about the change in time to adjust their decisions during the October to December enrollment period. So if they like their doctor, seniors may be finding out just now that they cannot keep him or her because they are no longer included in the plan. Passing H.R. 2453 and restoring the 90-day open enrollment period during the first quarter of the year would let seniors react to these types of plan changes, many of which are driven by the harmful cuts to Medicare Advantage that we see happening as a result of the Affordable Care Act. H.R. 2453 is a patient-centered option for improving Medicare Advantage. It will provide choice for seniors and will ensure that they have access to the doctors they know and trust. That is why it is supported by America's Health Insurance Plans, the Association of Mature American Citizens, and the 60+ Association. The subcommittee members and its chairman should be thanked for their efforts to strengthen Medicare Advantage. Medicare Advantage delivers quality health care and peace of mind with consistently superlative satisfaction ratings from participants. Preserving the program and preventing more cuts to Medicare Advantage is a top priority for me and for the seniors in Pennsylvania's 12th district. Incidentally, in my district, utilization of Medicare Advantage is in excess of 60%, more than double the national rate. Additional cuts to Medicare Advantage will lead to higher out-of-pocket costs, reduced benefits, and fewer plan options. Instead of limiting access to a successful program which 9 out of 10 seniors are satisfied with, we should be empowering them to make choices about what best suits them. We should make sure seniors have access to the health care providers they know and trust. Instead of cutting Medicare Advantage, we should be finding solutions to lower costs for seniors and sustain the program for the long run. I had an incident this past Monday with a senior in my district at a restaurant. She was the hostess, and she expressed to me a real concern about the cuts to Medicare Advantage, personally impacting her. I asked her to call my office and give us more background because I want to tell that story here in Washington. And she simply looked at me and said, "Why? So the politicians can accuse me of lying?" That's what's happening out there in the country, and people are very concerned about what's happening with Medicare Advantage. I thank the chairman, and I yield back.
Chair thanks the gentleman and now introduces the gentlelady from Indiana, Ms. Walorski. I recognize her 5 minutes for opening statement.
Thank you, Mr. Chairman. Chairman Pitts,